Hello, everyone. Welcome back to the War Within podcast. Today we have another special guest. He is a man, bachelor's degree of science 2001, doctor of chiropractics 2003, doctor of medicine 2009, eternal medicine residency 2012, hospital medicine physician 2012 through 2015, CEO and founder of Performance Medical Clinic 2015 to present, additional certificates in hormone replacement therapy, functional medicine, longevity medicine. Dr. Michael Ambrose, glad to have you on here.
Thanks for having
I've
me.
been excited about having this when we're here, actually. I don't want to waste a bunch of time. Usually I kind of go through, I guess, could you give us a rundown, possibly like where you from, kind of, a little bit of your life, and then we'll get into all the good
Yeah,
stuff.
so I grew up in Bethalto, Illinois, which is close to here. And after high school, I went to chiropractic school and decided chiropractic. I learned a lot, but it wasn't for me. And then I went back almost directly into med school after that, and then finished my internal medicine residency. And since then, that was about 10, 12 years ago, and I've been practicing medicine ever since. I've worked in the hospital, and about 7, 8 years ago, I set up my clinic, Performance Medical Clinic in Edwardsville, with our focus being predominantly hormone replacement therapy for men and women. And then we also do weight loss therapy, and we also do longevity medicine, which
Hmm.
which is kind of a hot topic right now.
Yes. Yeah, that's exactly, we're going to get into a lot of that stuff. Cause this is like, I love this type of stuff because essentially, like, to me, there are so many, ways to enhance your body and essentially become superhuman and live longer. And I mean, obviously you still have to put in the work and, eat a certain way and whatnot, but there's a lot of, different, I guess, pharmaceuticals and peptides and whatnot that could essentially do wonders for people.
Yeah, absolutely. Our focus with our patients is education. So, a lot of misinformation you can find online and social media, and you got to take this supplement or you got to take that supplement. When in reality, what it boils down to is most people need to change their lifestyle.
Yes.
So, diet, exercise, nutrition, some supplements can help, also, but I look at everything as a tool. So, like with hormone replacement therapy, it's just a tool to give you the motivation and energy and things that you need to do in life to actually be healthier and live healthier.
For sure.
Yeah.
Yeah, I mean, I've been with you guys, I think, well, since you was over in Swansea, actually. So I don't know how many years ago that was.
Probably 5, 6, 7 years, I'd
Yeah,
imagine.
so
Yeah.
and I mean, whenever I remember I came to you because I was using steroids and I didn't know what the hell I was doing. And I met a guy, and I've always been into lifting weights. And so I had met an individual that was like, "Look, take this, and this." And ultimately, my dick wasn't working, and I'm like, obviously, I screwed some stuff up, and not to mention, like, having ups and downs and all that stuff. But and there's a lot of people like that. There's
Yeah.
especially with, like you said, with social media and just I guess YouTube fitness influencers. Like, I see it all the time. You got individuals like, take 200 of this a week, and then you this and this, and you're playing with your hormones. You're playing with your body, and could essentially screw it up. I mean, there's a lot of stuff that could transpire out of that.
Well, you got to be careful with hormones. I mean, they are a drug. They're a controlled substance, but as with anything, more isn't always better.
Right.
So a lot of people that use anabolic steroids or whatever, they do screw up their endocrine system, and sometimes they can rebound from that on their own naturally just by
Mm.
coming off of it. But they crash too. So I think finding an appropriate physician to work with to get you on the right regimen can actually do a lot of good for patients. And
Yeah, I think that's super important too because, um, one thing that I've noticed with a lot of people whenever, because I talk about TRT and these things because they've changed my life, in a lot of ways. I mean, um, but I think a lot of people, they listen to their primary care doctors, and both primary care doctors I've ever had are like, you're gonna get prostate cancer, you're gonna, die of heart disease, and when you start looking at the new and more research that is coming out, like you should, obviously at a certain age, and you should be getting your blood work obviously done is what's important, and I tell people this all the time, at least if you don't do anything, at least get your blood work done twice a year. That way you can see where you're at, what you can improve in. I know that with the nanograms per deciliter on a lot of blood work, it has been dropped down due to overweight country, basically. Is that's true,
Yeah.
correct?
Well, so and every lab has their own different reference range, right? So, and those are close to normal, but in reality, they're reference ranges. So, and primary care doctors aren't really, in line with optimization of hormones. They just don't understand what that means. So they'll look at a reference range of maybe 250 or 300 up to 900 or 1,000 and say, oh, you're 375 or whatever. But we have data that shows that if men can get their testosterone levels up to around 800 to 1,000, something like that, and they're doing it safely without huge fluctuations in testosterone, then they have significant reduction in diabetes, metabolic health issues, which is huge because
Mhm.
hyperinsulinemia causes all chronic diseases, whether it be heart disease, cancers, obesity, whatever. So you want to look at what your numbers are optimally, but some guys feel good around 600.
Yeah.
It just depends on what their goals are, individually. And so I think if you can keep, levels higher than 2, 3, 400, then the benefits outweigh the risk for sure, long term.
Yeah, I mean, because I remember I had my primary care doctor check my testosterone before I came to you, and it was at like 240, and he was like, "Oh, you're in the normal range," and I've even had conversations with people that are, overweight. That like I said, I'm very passionate about this stuff, so I get in this conversation with a lot of people, and I know that their numbers are probably pretty low. You know
Yeah,
what I mean? And they'll be like, "Oh, my doctor said I'm in normal range," and I always tell them like, "Look, you need to go to like either an endocrinologist, somebody that knows about this, because it seems like the primary care doctors are always going to push that narrative as long as you're, and then not to mention like, what." How do we know what your testosterone originally was? You know what I
sure.
mean? When you
5
was
years ago,
born,
10 years ago, it might have
yeah,
been 700 and you
you
felt
know
better. Now it's 300 and you don't feel good. And there's,
exactly. And here
and
goes another one for you, not to cut you off, but Um, does the number matter, or is it about the, symptoms? You know what I mean? How do you feel?
yeah,
You
well, the
know?
vast majority of patients, if you get them to that 800, 1,200 range, they feel pretty good. There are some guys you can push the envelope a little bit and get them a little higher if their goals are different, or they have a little more metabolic issues, or they're experiencing good benefits at 7, 800, but they might have more at 1,000, 1,200. It just depends. So again, testosterone is just a tool,
Yes.
right? So and that's why with our patients we talk about diet and exercise and lifestyle and things they should consider adding to their regimen to help their outcomes. I can't count the number of patients that come to me and they're 50, 60, 70 pounds overweight. And they've been to other hormone replacement therapy clinics and they just got started on testosterone and they feel a little bit better, but their sleep is still wrecked because they're overweight.
Mhm.
And once you start talking to them about calorie deficits, weight loss, making sure they're getting 7 to 9 hours of sleep, it can be a game changer for them.
Mhm.
You know,
Yeah, so actually, you know what? Now I think about it, before I came to you, I was listening to 105.7 The Point, and I went to, Victory, and, one thing that, uh, they scared me away, and I'm, I'm not trying to shoot shots at nobody, but I went there after my, 90 days, and I sat down and with the lady, and she went over my blood work, and she told me that I needed to take two anastrozals um, from now on, and I started looking into this later on since I've been with you with the anastrozole, and I want to get into this as well. But so as I was getting ready to go out, because I was just gonna go by what she was telling me, you know what
Sure.
I mean? Because they're supposed to know it, and the actual nurse practitioner came running out, was like, no, 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 no. You don't need to take any more of the anastrozole, you know.
Yeah.
And essentially, then whenever I started following like Jake Campbell, I listened to a lot of his stuff, and a lot of there's a lot of people out there. I look at a lot of different stuff, bounce different stuff off, buy books and everything else, but you know, I could essentially crashed my estrogen. You know what I mean?
Sure.
It's a very
Yeah.
powerful drug.
Well, years ago, we used to, I mean, men's health and hormone replacement therapy has come a long way just in the last 5, 10 years. Initially, whenever we started prescribing testosterone, the thought was that estrogen is bad for men, and it's really not. So there's plenty of data now that we need estrogen in our bodies, not only for libido and sexual function, but it also helps with nitric oxide production in the body. It also helps with it's an anti-inflammatory,
Mhm,
and muscles also requires estrogen to build muscle.
mhm.
So our bodies need estrogen, and there's now this push that nobody needs to be on
Yeah.
anti-estrogens. It's 100%, and that's not entirely true either. I've had two patients in the last 4 or 5 months where following up on their blood work, and their estrogen may be 120, 130 for a guy.
Mhm,
And most guys can tolerate that, but sometimes if your estrogen creeps up too high, then you can get some mood issues and some, depression and different things like that. So you need to tailor each individual treatment plan to every patient's needs. Now, I agree you don't want to overly suppress the estrogen,
mhm,
and get it down to the teens or 20s, but taking someone from 120 down to 80 might be beneficial in that
mhm.
person. Everyone responds differently to hormones, so there's not a um, you know, uh, one size fits all type of treatment plan for everybody. Everyone has to be individualized.
Yeah, I think I said this over the phone when we were talking. I mean, in a way, it's kind of like a science experiment on yourself, anyways. You know
Yeah,
what I mean? Because, like you just said, not everybody's the same. Now, for me, like what I've noticed is, this is with the shooting protocol. I microdose, so every single day I inject. Well, 6 days a week, then I take Sunday off. Uh, and it's completely changed everything,
yeah,
as far as with me. Now, a lot of people don't like to inject every day, and then um, the thing the thing with injections too. They you always get these harpoon needles,
yeah.
and I use a 29 gauge insulin needle, and I can draw with it and inject with it. It just takes a little bit longer, and
Sure.
I think that's something that people you know what is the normal, what, a 25 gauge or something like that?
Typical 25 gauge for a 1 inch needle is
And
what we
and I'm
use for
sure, yeah,
most
you guys
patients.
have to, like, I'm sure that you guys have to abide by certain regulations when it comes to certain stuff, as far
Not
as,
really.
no?
No,
Okay.
and we're pretty much allowed to do what we want,
Okay.
as long as it's reasonable and in the best interest of the patient. And um, getting back to kind of dosing, the original thought was, 5, 10 years ago that once a week dosing is fine because the half
Yes.
life is 7 to 9 days, or depending on the type of testosterone you're taking. But we have literature now that subcutaneous injection is probably a little bit better,
Yeah.
and absorption is similar. And also doing it 2, 3, 4 times a week is probably better than doing it once a week
Yeah.
because you have less, peaks and,
Spikes.
and,
Yeah.
and valleys, so to speak, on your plasma concentration. And that's when you get all the side effects from testosterone. If you're doing it once a week, you're peaking day 2, day 3, and then you're dropping about 50% of that on day 7, 8, 9. And whenever you're dropping, you don't feel so good. And
Mhm.
whenever you're really high, that's when you're making extra hemoglobin, having extra estrogen conversion, things like that. So, there's plenty of evidence now that twice a week is probably, it's
Sufficient.
better than once a week for sure.
Yes.
And then we're getting more literature that even extending it beyond that, going into 2, 3, 4 times a week is probably better. But again, you're right. Nobody wants to give themselves shots
Yeah.
every single day,
What
so
what
it's
do you
tough.
Oh, go ahead. Go ahead. Sorry.
Yeah, it's
What?
it,
Oh, go ahead.
it's just most guys. I don't blame them. They don't want to give
Yeah.
shots every single day, but the insulin syringes are tiny little baby needles, and they're pretty easy to tolerate.
I mean, the thing is finding the rotation. So I rotate on the top of my thighs, and I rotate on my side delts. Um, and I use a half inch needle, 29 gauge half inch needle. Because yeah, like so as far as the subcutaneous, then is it's compatible, you think, as far as intermuscular? Because obviously I'm still getting intermuscular with a half inch needle. You
You're
know what I
you're
mean?
you're probably getting a little bit of both. Yeah, it's tough to say. Depending on how much body fat you got and everything
Yeah.
else, but absorption is very similar across the board. In fact, subcutaneous is probably a little bit better.
Okay.
So I usually tell most of my guys to do it in the hip. Even with the 1 inch needle, for most of my patients, it's still subcutaneous.
Yeah.
Because the needle's about 1 inch, and most guys have extra body fat. So if they're doing,
Really?
yeah,
So no doubt. I figure. So so I mean, if you got low body fat, then what are you talking about? Maybe what? How far to
oh,
hit
it
a
just
muscle
depends. I
tissue?
mean,
You think?
men carry it in their hips and their belly. So I mean, um, probably 1 inch is
Okay.
probably subcutaneous
Okay.
versus like an inch and a half would probably be more intramuscular.
Okay.
And again, those are nuances. The main thing is checking plasma levels and making sure they're feeling good, and then also monitoring their metabolic health and
Mhm.
their body composition. So we do body compositions on everybody on their second visit with us, and we look at fat free mass index, and we also look at their fat mass index, and you can see the trends within 3 to 6 months. Their body fat's dropping and their muscle mass is going up, and that's what you want to look for because the muscle is the driver of your metabolic health.
Mhm.
Where we store glucose, and so especially if you're exercising, eating protein, and doing all the right stuff, you're going to increase your muscle mass with testosterone, and then you're going to get all those biomarkers of chronic disease are going to start to improve too.
Yeah. Yeah, I know that, like, especially with the research of, the leaner you can get, the more muscle tissue you can get on you and the less fat, it just enhances the whole,
Everything. Yeah.
testosterone replacement therapy. And now, like, I've pretty much got it down to a science. I mean, I've never really checked how low I've gotten on, body fat because it's not that super important to me because I just really exercise and I just wanna feel good, you know what I mean?
Yeah.
And I wanna live
It's a
longer.
lifestyle. Yeah.
So, that's where it's at with me. And I play around with like different diets. I mainly do like a carnivore style diet, but then, I eat fruit and sometimes I eat rice, Um, but that's another thing is what I was wanting to ask you too was like, so people that carry around more fat, do they carry around more estrogen? Is that correct? Because I've always heard that estrogen is stored in the fat tissue.
It's true for some, but not for others. I mean, you can see estrogen numbers all over the place. It's true that your body fat does aromatize testosterone and estrogen more. So we typically do find that men with and women that with higher amounts of body fat, they do tend to aromatize. If you give them supplemental testosterone, they tend to make more estrogen from it. But again, it's whether or not they're symptomatic from the estrogen conversion,
Hmm.
whether or not you treat it, and that's pretty rare. The
Hmm.
vast majority of guys don't need an aromatase inhibitor. They don't need an estrogen blocker or anything like that. So you want to keep your estrogen level, and for sake of conversation here, usually between 30 and 80, 30 and 100, something like that.
Hmm.
That's a good estrogen level to be at for most men.
I got you. Yeah, that's another thing. Like you were you touching on earlier with the ups and downs of when you're using testosterone, your estrogen spikes. With your testosterone. Is that correct?
It can if you have high amounts of
Okay.
testosterone, you're going to aromatase
Well,
more.
I always think of whenever they're like, "Oh, he's got roid rage." Well, it's probably because he's spiking his estrogen and he's having actual estrogen effects. I mean, because essentially higher estrogen is kind of like a woman being on her period, I guess, or
Yeah,
like going through something of that nature to where it's like I feel like a lot of times compounds get blamed,
Hmm.
and it's really the person doesn't know what the hell they're doing,
Yeah.
because there's people that know the science behind some of this stuff, and they're able to use anabolics and different stuff. And I'm not trying to promote that. I'm just saying that there are people that know the science and they know how to play with these compounds and can essentially use them to benefit if they know what they're doing. But the whole roid rage, I believe, is people that don't know what the hell they're doing and they get their hormones all out of whack.
Yeah,
And then
they're abusing something or an anabolic or
yes,
whatever, not doing it safely. I've never experienced an episode of roid rage in my practice
right,
in 10
right.
years of it just doesn't exist, you know.
Yeah,
If you're doing it the right way, it just doesn't happen.
yeah,
And going back to anabolic use, I mean, there's plenty of literature and that if you use anabolic steroids for a period of time, your risk for heart failure goes way up.
yes,
So you got to be careful with anabolics, and we just don't see that with testosterone, especially at physiologic doses, even or
yeah.
even at super physiologic doses. You don't see it. Just don't see that with
Yeah, and
testosterone.
I think that, like you said earlier, less is more. And like I watch a lot of fitness videos and a lot of people like that. And one thing, like I think it was somebody on YouTube put a video and they were talking about this whole cycle of use trend and all this other stuff. And Lee Priest, which is a famous bodybuilder, he's like, look, you can do the same thing with testosterone.
Yeah,
Like you can get the same benefits with less issues, essentially of using these other compounds and still put on the muscle mass and everything else and without having issues. Um One thing I wanted to touch on was the whole thing about donating blood. How important is this? Because there's so much back and forth on this kind of
yeah.
stuff.
Well, if you're symptomatic, there's some guys that will get a little flush in the face or have a little, tightness in their chest or something like that when their hemoglobin gets high or whatever. Then obviously there's the symptomatic reason to do it. But there's nothing really harmful until you get what I look for is a hematocrit greater than 55. That's whenever you want to start, talking to patients about maybe doing some phlebotomy.
Hmm.
Some guys just like to do it because they can go donate blood and it makes them feel good, and they're helping
Yeah.
other people, and that's fine. And if they're in that camp, then I would say 2, 3, 4 times a year is probably okay.
Mhm.
But patients that donate every 2 months or so have a tendency to develop what's called iron deficiency. Um,
Mm.
so you don't want to just do it willy nilly and just do it to be doing it. But a couple times a year, it's probably helpful, and it's also helpful to the community. And you can
Yeah.
donate blood. And I donate blood regularly too. But when your hematocrit gets above um, 55 or your hemoglobin above 18, 18 and a half, something like that, that's when you want to start
Okay.
really considering being on some sort of regimen to donate blood. But there's really no harmful effects of having just a slightly elevated hemoglobin. You have higher oxygen carrying capacity in the blood and all of that.
Yeah.
So the absolute number would be a hematocrit of 55, but everybody's different. Some people get a little symptomatic at 53, 52, and you say, well, go donate blood, and then they just feel better.
I actually I went and donated blood at um Red Cross. I tried to go donate at Red Cross up in Rosewood Heights first time, and they have the questionnaire and they ask you, have you ever used steroids or whatever, and I put yeah. And they banned me
Kicked
forever.
you out of the system.
Yeah. So now I go to another place, and I just always say no. I mean,
Yeah.
because I even though I'm just doing this through the doctor and everything, it's one of these things where I don't want to get banned.
Yeah.
And I don't understand why they did that.
Well, sometimes it's travel. I've had some military people that they travel to certain areas of the world and they can't donate blood. And other people, it's if you tell them you're taking some sort of aromatase inhibitor, that's typically used as a drug for females for cancer.
Yeah,
So you'll automatically just get kicked out of their system and not be able to donate if you say yes to certain things, even though we know it's perfectly fine. It's not harmful for anybody to donate blood.
yeah,
Or if you've had certain communicable diseases or whatever. That makes sense, obviously, but the vast majority of guys on testosterone don't have any problems donating blood at the Red Cross or
Yeah.
whatever, you know?
Yeah, so you got people are getting blood transfusion and getting all buffed up and everything. You know
Yeah.
what I mean? There's some woman out there walking around with 30 pounds of muscle tissue. Uh, no, but that's another thing that I wanted to touch on because testosterone and hormone therapy. When you look at a lot of the issues that people have, like anxiety, all these different things, there's more and more research that shows that it, you know, your hormones, optimizing your hormones and getting all that stuff on track can essentially change everything,
Yeah,
compared to
absolutely.
just going to your primary care doctor where they're handing out a pill instead of looking at the source of the problem and trying to figure out what is going on. It's just become, here, take this, get back to me, or this and that, and it's scary because it seems like more and more practices are like that now. Um, at least at my experience and experience that I hear from other people. So I think it's very important that people need to get blood work and get their hormones checked because they could essentially change a lot of this stuff. And like you said, was like, not to mention just minerals, vitamins, all this different stuff before you go off and you get on some type of medication. You
Yeah,
know,
well, just touching on what you mentioned about how it can help with other things too. I can't count the number of patients that come to me with anxiety, depression, and a lot of it's just motivation. I mean, there's plenty of literature and that testosterone can help with neurotransmitter synthesis and neuronal connections in the brain and all of these things. It's just a tool to use. And I've had patients get off of anxiety medicines, get off of these SSRIs because they use testosterone as a tool to start going to the gym. And then when they start going to the gym, they lose a few pounds. So then they become motivated to eat right and,
hmm
increasing their protein consumption. And then everything just gets better. And exercise is probably one of the best antidepressants that we have out there. It increases endorphin release and serotonin release, and it's just an important aspect of anyone's lifestyle to help with depression, anxiety, all those things, and
hmm
even for women, a lot of women, and when they become perimenopausal and you give them a little bit of testosterone, they notice muscle mass changes, they lose body fat, and then they're motivated, to do
Yes.
things. So,
Yeah,
and
that
everything
that
gets
was
get better.
that
Everything
was
gets
going to
better.
be what I was going to ask you about was the whole menopause thing because you only when you hear testosterone you always just think of guys. I think it's the main thing, and women go through menopause and it's has to do with their hormones, and there's ways to optimize their hormones as well through some of the stuff that you guys do, and it's there's I feel like people just don't get informed about all this stuff and the things that they could essentially do to feel better. I mean, the just even without doing this stuff, like you said, just exercising. I hear it all the time, like especially whenever I was in the union, guys would be like, "Oh man, I'll get a plenty of workout at
At
work."
work, yeah.
Doing concrete and this, it's not the same. And then the confidence you build a confidence in a person, you know what I mean?
It's work ethic. I mean,
Yes.
if you start developing, I mean, my life changed dramatically when I started structuring everything. You know what I mean? So, stop going out and eating dinner and having a few drinks and going to bed at 11 or 12 or 8 or I mean, just my life was, I never had any problems with anything. But when I started going to bed at 9 o'clock every night, which is what I do now, maybe 20 minutes off or something like that.
Yeah.
I wake up at the same time every morning, 5 o'clock,
Mhm.
it's just about setting that routine for yourself. If it's just something you're going to do, you're going to go to the gym that provides structure in your life, and then you start executing other things, whether it be
Yes.
business or relationships or whatever it is. And again, going back to hormones, it's just a tool. Balance your
Yes. Yeah.
hormones, feel better, change your life, get on a regimen, get on a routine, start working out, even if it's 20 minutes a day.
Yeah.
Just go for a walk or get some sunlight or whatever it is. Start somewhere,
Yeah.
and then you'll see incremental changes in your life, and that's whenever you can see some, real benefits overall.
Yeah, I think that's a good point. Is people overcomplicate a lot of stuff. Definitely, I say this all the time that structure is the number one thing for my life. That's why, like being in prison and stuff like that, it helped me. Because I've always had structure. There, I know what time the chow, what time is to go. Like everything was about structure, and that's why I got discipline equals freedom tattooed across my neck because I know that whenever I don't do certain stuff on a daily basis, I don't feel the same. You know what I
Yeah,
mean? And not to mention just goals, setting a goal, setting whatever the goal is,
yeah,
Um, with the workouts, a walk is super powerful. I mean, you look at some of the research on a walk compared to somebody taking metformin,
hmm
you know what I mean? Which metformin, I want to touch on that a little bit later, but just taking a 10-minute walk after eating your meal for diabetic people is
yeah,
extremely powerful. And, you know, people would rather take a pill,
yeah,
and
yeah,
these are like with the red lights, the grounding, all this different stuff. There's actual science that backs this stuff. And these are things that have been around for years. It's not, you can essentially do all this stuff without buying all this equipment,
yeah,
really. You know what I mean?
absolutely. Well, I kind of refer to it as the 80-20 rule. I mean, 80% of it's lifestyle, and that costs nothing. You know,
Yes.
So making sure your diet is clean, and it can be any diet outside of the standard American diet is better than obviously the standard American diet.
Yeah.
Processed foods, you can, doesn't matter if you choose carnivore, keto, whatever it is, or Mediterranean or whatever it is. It doesn't matter. It's still cleaner than what the vast majority of Americans are doing. They're eating processed food and chips and
Yeah.
cupcakes and all the junk, and make 80% of it. You can do it for free. Just diet and exercise. Get some movement in, whether it be in a small room in your house or go for a walk around the block or whatever it
Hmm.
is. I mean, that's and if you have the extra money and disposable income to spend on extra things, then go for it. You know.
Absolutely. Yeah. I mean, and also, getting your kids started in these type of routines, that's the most important because I mean, in order to change what has transpired with our culture, I mean, you have to start at the kids, you know what I
Yeah.
mean? And I think a lot of people, um, they just get tired of hearing their kid cry, so it's just like, "Here, just take this bag of Skittles,"
Yeah.
and,
Or this ADHD medication or whatever it
yeah,
is.
that's a
It's
big
huge.
thing, especially like my nephew, that they put him on the Adderall and stuff like that, and,
hmm
he was having really bad downs, off of it, and I mean, it's super. I mean, it's like statins that like super overprescribed. You know what I
hmm
mean? It's just give a person something to get them basically. Man, it's crazy. Whenever you start breaking some of this stuff down that we're doing, and there's so many simple things, and especially even with diet, I feel like everybody's like, oh, it's so expensive to eat healthy. But I think the thing is stop buying box foods. Stop buying stuff in these aisles. You know what I mean? Try just there's all kinds of options of being able to shop,
Yeah.
half-ass decent,
Just eat real food. That's the main thing.
Yes. Yeah.
Fruits, vegetables, nuts, seeds, lean meats. Just go for it. It's you don't have to overcomplicate it. You don't have to follow any particular plan or anything like that. Just clean up your diet and you'll feel much better.
Yeah.
You know.
Losing the fat on people is huge, especially
Yeah.
like blood pressure issues and like my sister, she had which before she did, we were talking. She had the gastric bypass, which is extremely bad surgery on your body. Now she's having issues. She's
hmm
got like blood issues and autoimmune issues, which I don't really know what the autoimmune issues are, but nothing you do can compare to structure and discipline as far
Absolutely.
as food, lifestyle, like you said. I mean, and everything outside of that is just a tool.
Yeah.
And so I just feel like people just overcomplicate it or they're just misinformed or they're just probably just too lazy, you
Well,
know?
And again, I think for most patients and most people, it starts with making small changes. Um, you know, trying to stick to one thing, turn one thing into two things,
Hmm.
and two things into three, and then next thing you know, you can make some big changes. But
Yeah.
just start somewhere.
Yeah. Yeah. So on the metformin, seeing more and more people are starting to actually take metformin because there's, I haven't looked at so much of all the research on it, but I guess even people that are complete dumpster fires that are on metformin are essentially outliving people that are in good health from taking metformin.
Well, so metformin, obviously we use it for diabetic patients, and it does a couple things for diabetic patients. It prevents the glucose production within the body, so it does help with hemoglobin A1C. It does postpone diabetes, so if you're on a poor diet, it helps postpone the time from whenever you are pre-diabetic to diabetic. And but its main mechanism is through a pathway called AMP kinase. And AMP kinase is one of the 4 or 5 longevity pathways within the cell.
Mhm.
So it increases AMP kinase, and basically AMP kinase measures the amount of energy or energy depletion within the cell, and then it can augment other things like mTOR. So mTOR is the other pathway. So now we're getting into the biochemistry of longevity.
Mhm.
But patients that take metformin have shown stabilization of plaque. So if you are prone to cardiovascular disease, it'll help stabilize plaque. It'll help lower blood sugar, and it lowers hemoglobin A1C, which we kind of touched on this earlier. But insulin resistance is the driver of almost
Mhm.
every chronic disease out there, whether it
Yeah.
be Alzheimer's, cancers. The downside to metformin is obviously it can cause some GI side effects,
Mhm.
loose stools, diarrhea, constipation, things like that, upset stomach. But the vast majority of patients can tolerate it. Usually those are short lived, and then they get benefits from metformin after that. In patients that exercise a lot, it's also been shown to, these are elite athletes. It lowers what's called lactate threshold. So lactate threshold is the amount. It's basically the amount of exercise that you can do before you start spilling over lactate into the plasma. So and endurance athletes, Tour de France,
Mhm.
cyclists and marathon runners, they have a very high lactate threshold, meaning they can do a ton of exercise before they start spilling over lactate into their bloodstream. Um, so we don't quite understand the negative effects, if that even poses one, in the average person, right?
Mhm.
But we do know in athletes it lowers lactate threshold. Um, so obviously that needs to be looked at more, and they're doing data
Yeah.
now on large trials on metformin and longevity to see if patients can actually live longer. So the vast majority of people that I see
Yeah.
are pre-diabetic,
Yes.
30s and 40-year-old guys and gals. They'll come in, their hemoglobin A1C is 5.6, 5.7, 5.8. And my goal is to get everyone down to 5.2.
Mhm.
So we can use that as a tool, and we'll see their A1C drop even at low doses, along with changing their diet and lifestyle. So, but you have to use it in the right patients.
Yeah.
Not everybody needs it.
Yeah.
Um, so I like metformin as a drug, and for prevention of hyperinsulinemia, prediabetes, and also cardiovascular disease prevention.
Yeah. Touch on basically explain kind of how people lose their insulin sensitivity because I think people need to understand this, especially with the with our diet, eating a lot of sugars and constantly spiking your insulin. You burn out your receptors. Basically, is
Yeah,
what transpires.
so obviously hyperinsulinemia is a key for this, right?
Because I think people get this misconstrued that you have to be fat in order to be diabetic, and you can essentially you don't have to be fat in order
You
to be a
don't. It's
diabetic.
a risk factor, obviously. The more people that are overweight or obese do have diabetes, but I see guys all the time that are ideal body weight and they're insulin resistant. So and if you dive into literature, which that's what I tell my patients is that's my job as the
Hmm.
physician is to know this stuff. There's about 16 or 17 different causes, and it ranges from everything from gut dysbiosis to mitochondrial dysfunction to intracellular triglyceride or fat deposits. But probably the biggest reversible or modifiable risk factor, and you can do some research later or go on YouTube or
Mhm.
whatever. It's called the personal fat threshold,
Mhm.
which triggers what's called the twin cycle hypothesis.
Okay.
And what that is basically if you're consumed excess, if you throughout your lifetime, if you've consumed excess calories, and it doesn't have to be sugar,
Mhm.
it can be just calorie excess. What
Mhm.
happens is you get production of triglycerides, and that's through diet and also through the liver. But when those triglycerides go up, they get deposited in the muscles, they get
Mhm.
deposited in the pancreas, and they get deposited into the liver.
Okay.
And whenever they get deposited into those cells, the cells just don't respond. I call it cellular resistance because
Mhm.
hormones won't respond. Insulin doesn't respond, so the body compensates by making extra insulin. And insulin's a growth hormone,
Mhm.
and that's why you see hyperinsulinemia causing just about every chronic disease out there, whether it be cancer or whatever. So when you talk about reversing this, how do we reverse this in patients? It's a calorie restricted diet,
Mhm.
and also and most notably processed foods, because there's nothing inherently bad with having a cupcake every once in a while.
Right.
It's the fact that we don't have just a cupcake every once in a while.
Yeah.
We have a cupcake and a bag of chips and a soda and a Big Mac and
Yeah.
all of the
Yeah.
things, right?
Yeah.
And it's extra calories in
Yeah.
general that cause this. So
And,
it's
and it's easy to get extra calories because a lot of people don't look at how much is actually in that bag of
oh
chips,
yeah,
or
and
it's
they
ridiculous.
don't produce any satiety. You don't feel full from them, so you
Mhm.
just continue to consume them.
Yeah.
So just by taking out processed foods from your diet, then all of a sudden things get better. But
Mhm.
I'm not immune to liking donuts. I have
Right.
young kids.
Right. Right.
Sometimes I might go to the donut shop on a Saturday, and that's okay. It's just instead of eating 4 donuts and a
Yeah.
chocolate milk, I'll have a cup of coffee and 1 donut. You know
Yeah.
what I mean? So
Yeah.
it's you have to balance these things with your lifestyle, that's for sure. But the mechanism is the personal fat threshold and the twin cycle hypothesis. So when you educate patients on this, then they're like, okay, well this makes sense now, right? All I need to really do is start by calorie deficit. Start
Mhm.
there, and then we'll talk about what particular foods to eat. And there's a lot of nuance to that. And I call that nutritionism. Like if you're scrolling through TikTok or whatever, these are just nutritionisms. And in reality, if you just cut calories, you're gonna feel better. You're gonna lose body fat. And the other component of this is high protein.
Yeah.
So because if when we talk about personal fat threshold and the muscle, which is our primary driver of metabolism, where we store glucose, it's where we
Mhm.
store protein, all this occurs in muscle. We want to improve muscle mass in patients, and by doing that, you'll break down fat,
Mhm.
and you'll start to mobilize fat throughout the tissues in the body, and then all your cells start to respond again. So calorie deficits, exercise, protein consumption, and lifting weights,
Mhm.
that's huge.
Yes.
Um, so you have to incorporate all of those once you start chipping away at your lifestyle, and then everything kind of gets better. And in fact, there was a study called the Direct Trial,
Okay.
and this was published in Lancet 2018. But they did was had patients lose weight. They didn't really restrict them in any way, shape, or form on the types of foods that they were going to eat.
Mhm.
And if patients lost about 35, 40 pounds, 86% of them reversed their diabetes just from weight loss alone.
Mhm.
So it's the excess calories, excess fat, excess deposition in tissues that leads to, prediabetes and diabetes. And
Yeah.
I see it all the time. If the patient's just lost 10 pounds, and even myself, 5, 6, 7 years ago when I started this journey, my A1C was 5.5, 5.6, but I wasn't grossly overweight.
Mhm.
But I lost 15 pounds and my A1C dropped to 5.3
Mm.
just by losing 15 pounds and putting on a little bit of muscle. I put on about 3 pounds of muscle,
Yeah.
through lifting weights and protein
Yeah.
consumption. And then protein consumption is a whole other topic that,
Yeah.
that
Yeah, that's another thing, like, especially as you get older, they say you should consume more protein, we're talking about muscle tissue, they say it's the biggest organ in your body, and it's extremely important the older that you get to, pack on as much muscle unless you wanna be a frail person
right.
and have an injury. Not to mention, like, when you just look at injuries with people that have more muscle tissue, they recover faster. You know, they're more
Yeah.
prone to not getting hurt as bad in a car accident. Not saying that you can't
Sure.
die, but you know, I mean, there's a lot. I do this all the time. You know, it is a very important to lift heavy objects and challenge your body and your nervous system to these things. You know,
Yeah.
but just losing weight, like I was saying with my sister, you know, she lost over 100 pounds in probably a year, which, you know, I mean, there's a lot of that surgery. There's a lot of, you look at people that have had that surgery, it's pretty bad. You know, there's a lot of people that die very young after having that
Absolutely.
surgery, and now she's got complications. It gave her more confidence, which was great. So she started exercising and whatnot, but just losing that amount of weight, she's got off of all the medications. I
Yeah.
mean, you know, so you're talking about, she probably, even if she would have lost 30 or 40 pounds, she probably would have got off all the blood pressure medicine and everything
Diabetes
else.
meds, the whole bit.
Yes,
Yeah.
exactly.
Well, and there's even literature too that it helps chronic kidney disease. There's a whole slew of it. I mean, maintaining ideal body composition is important. And muscle is the primary driver of metabolism. So if you have a higher muscle mass, it raises your metabolism as you're just sitting here talking to people,
Mhm.
walking around, doing your normal stuff. So you're going to burn more calories at
Yeah.
rest or with activity. But going back to what you mentioned about if you live to be over the age of 60, 65, falls and accidents are a huge driver of mortality. So if you're cachectic and lack muscle mass in your legs,
Mhm.
and there's data on this too. They've looked at what's called hand grip strength, and also ability to do squats and different things. And um, if you have high muscle mass and most notably strength, and you're in the top 5% for your age and sex, you live on average 5 years longer.
Hmm.
And when you combine that with cardiovascular fitness, so what we use to measure that is, I kind of touched on lactate threshold before. That's one of the measurements you want to know, but also what we call VO2 max. So if you combine that with a high VO2 max along with muscle mass and strength, you can live on average 10 to 12 years longer. So that takes
Crazy.
your average person living from 75 to 77, 78, something like that, to their late 80s.
It's powerful.
Yeah,
Really
it's huge.
powerful.
Now
Yeah.
we're talking about elite, the top,
Yes.
5, 10%, 2%,
Yeah.
whatever. But again, just from going from the bottom 25th percentile up to the 50th percentile or the 75th percentile, you're going to get that appropriate incremental increase in longevity. So, and all that's free. It
Yeah.
doesn't cost anything, right?
Right.
It's not
Just
a pill.
you actually putting in the effort and the
Right.
work and changing all these little things, you know, that's a lot. I didn't realize
Yeah.
that. Because what is it, the average male in the United States is like, 70 or something like that? Do we know?
It was like 78, and I think they dropped it to like 76. And this is the first generation where we've seen a drop, and a lot of it has to do with because they obviously, mix these numbers up with all age groups, but mortality changes dramatically because of the opioid crisis and
Mhm.
and lots of suicides and things like that. But people just need to start moving more and getting more of an ideal body composition and improving strength and do some cardiovascular fitness,
Mhm.
and you can easily live 5 to 10 years longer just
Yeah.
by doing that.
Yeah, the grip strength. I talked about this to some other people because it's one of the main things that they can actually see, from grip strength, and a lot of people didn't even realize that.
Well, and then the question is it truly grip strength? Like, do people need to go home and start
Right,
just doing grip
right,
strength?
right.
Like
Yeah,
their forearm muscles will be huge, but everything else
yeah,
is
yeah,
weak.
yeah.
I think it's just a correlate to their whole body strength,
Yes,
right?
yeah,
And when you're designing a program for somebody, they obviously want to work out their whole body. They don't want
yeah,
to just
yeah.
go home
Exactly.
and do grip strength. That's not
Yeah.
going to do it. But
Well, I tell you, being in whenever I was in the laborers and everything, there's so many people that are in their 40s, late 40s, middle 40s, early 50s, that their bodies are completely broke down.
Yeah.
and it's just crazy, you
Well,
know?
and I think dedicating time to exercise
Yes.
is it. Everybody that comes into my office, they're like, "Well, I always ask them, do you exercise or anything like
Yeah.
that?" And yeah, getting steps in are important, right? And like, well, I get 10,000 steps in, and that does correlate to living a little bit longer and reducing your risk for cardiovascular disease. But whether or not that's because you get 10,000 steps in, or just because you're healthy enough to do the 10,000 steps,
Mhm.
I mean, there's so many variables there when you tease
Yeah.
out the literature. Um, but I think what I tell people is I want you to dedicate time to exercise because it starts the mentality of, okay, I got to do this, right? I'm gonna check this off. I
Mhm.
did this today. Like if I do that enough days in a row, then it eventually becomes a habit, right?
Yes.
And
Yeah.
once it becomes a habit, that's when you start experiencing all the benefits, and having that start to flow into other aspects of your life.
Yeah, yeah. I mean, yeah, and that's basically I do a lot of strength training. Whenever I do lift, I do a lot of supersetting. So I kind of kill two birds with one stone because then I'm kind of getting the cardiovascular aspect because I'm try to knock my work out pretty quickly. You know what I mean? But I'm ultimately lifting heavier stuff in order to try to gain strength and put on muscle tissue. So that's what works for me personally. But yeah, I mean, I tell people this all the time, and just getting out, exercising. A lot of people are like, oh man, like they think that it zaps their energy, and it actually creates
Oh
more
yeah,
energy in your life. You know what I mean?
yeah, you feel better,
Yeah.
even if it's just the mental aspect of it, and we can get into a little bit of what's the appropriate exercise regimen. I mean, really, first thing to do is just do it,
Hmm.
and do whatever you like and do whatever feels good and don't hurt yourself, right?
Yeah.
But if you want to tease into what's the best sort of regimen to do, I mean, with respect to lifting weights, I kind of rotate, maybe higher reps, lower weights, and I'll do
Hmm.
that for a couple months, and then I'll do higher weights, lower
Yeah.
reps, so
Yeah.
you're doing more strength versus
Hmm.
hypertrophy, that type of stuff. And I do what's called a push pull leg rotation. And again, it may only be if I woke up a few minutes late, it might be 3 or 4 reps of something.
Right.
You know
Right.
what I mean? And some days it might be 45 minutes to an hour.
Yeah.
It just depends. But you want to work out your entire body, and you want to make sure you're stressing your muscle and consuming protein to increase muscle mass.
Hmm.
And even a 1, 2, 3 pound muscle change difference over 6 months is good.
It's huge.
It's
It's
huge.
huge. Yeah.
So, and then, with respect to protein, um, there's all kinds of recommendations for that, but at least 1 gram per pound of ideal body weight. So I'm
Yeah.
6'1", my ideal body weight's about 190,
Hmm.
185. So, and it's hard to consume
Yeah.
185
Yeah.
grams of protein
Yeah.
every day,
Yeah.
It's so especially with working and 12 hours in the office, it's hard to do. So I'll drink 3 or 4 protein shakes. If that's your way of doing it, then that's fine.
Yeah.
But the active ingredient in protein, high quality protein, is leucine.
Mhm.
So leucine's a branched chain amino acid, and what it does is it stimulates mTOR,
Mhm.
which tells the muscle, hey, let's start increasing our protein synthesis in the
Mhm.
muscle. So you need to get, for most people, when they sit down and have a meal, that's about 30 or 40 grams of protein.
Yeah.
So a steak has about 40, 35, something like that.
Mhm.
Chicken breast, 30 to 40 grams of protein.
Yeah.
So you want to do that several times throughout the day.
Yeah.
If you can't do it through food, if you're on a calorie restricted diet, then go with protein shakes,
Yeah.
a whey protein or a beef protein isolate or something like that. Whatever your body will tolerate, then that's what you need to stick with. You
Mhm.
know.
Yeah, that's probably that's the most important thing that people probably need to understand that, a diet is something that you can stick with, you know what I mean? So, find something that is compatible to what you're doing and your lifestyle. Same with working out. You don't have to get an hour in. If you can get 20 minutes in, or
Yeah.
whatever, as long as you're doing something. For me, I try to consume a lot of red meat. The heart association, all this other stuff will tell you that it's bad for you and everything else, but I mean, it's the easiest way for me, and I
Yeah.
I always tell people, look, ground meats, super easy because I can buy ground meats. They're affordable, and you can mix them with a
Anything.
vegetable or a rice or whatever you want to do, and you're still getting, whatever you do. And what I'll do is I'll fluctuate stuff. So sometimes I'll eat carbs. Sometimes I don't. There'll be days, 2 or 3 days I don't eat no carbs. I'll just eat meat. And then,
Yeah.
it just play around with it. And I think that's the most important thing is that, people just they overthink these things and they listen to too many people on here and, but as far as the protein thing I wanted to touch on too was, you know, because you hear these different deals where your body can only intake so much protein at a time. So is it important to have multiple meals, or can you just consume, you know, essentially, like, I eat majority of my meals in the morning, you know what I mean?
Yeah.
Because I like breakfast, so but at the same time, what I do is if I'm gonna eat carbohydrates, I'll eat it before my workout or in the morning because I know that I'll essentially burn it off throughout the
Yeah.
day, and then later on at nighttime, because especially when we're talking about hormones, I've seen different stuff to where, if you consume sugars or certain stuff at nighttime before you go to bed, it can mess up some of your hormone
Hormone production.
production.
There's some evidence for all of that, but again, you have to individualize it for
Okay.
each patient. Um, is there a maximum amount of protein that you can absorb in one sitting?
Yes.
Likely.
Okay.
But again, is there a difference between 30 and 40, or maybe 10?
Yeah.
Absolutely.
Yeah.
But is there a difference between 30 and 40 and 50 or 60? Probably
Yeah.
very little,
Yeah.
right?
Yeah.
So you want to make sure whatever your protein needs are, you divide it up over, a couple servings, at least three, maybe 3 or 4 servings per day,
Hmm.
because you want to chronically stimulate that muscle protein synthesis. And,
Yes.
and, and two factors for that. Number one is making sure you're lifting weights,
Hmm.
and then number two is consumption of protein. The two drivers of how much muscle you can put on. So, and probably if you had to pick a time of day to consume the protein, morning is probably
Okay.
because your mechanisms inside the muscle tissue are more apt to put on muscle in the morning.
Hmm.
That's for multiple reasons. Your growth hormone is peaked overnight.
Hmm.
So growth hormone peaks, 3, 4, 5, 6 o'clock in the morning
Hmm.
and starts to come down 8, 10 o'clock in the morning.
Okay.
So, and also your testosterone. This goes kind of going into sleep physiology here, but our brain is regenerating as we're
Hmm.
sleeping, and there's different cycles of sleep that we go through. Deep sleep and then REM sleep, and then
Hmm.
there's some in between stages too, all of which are important. They all
Yeah.
have their own benefits and reasons why good sleep are important. But the brain is regenerating, neurotransmitters, and it's making growth hormone. It's signaling the testes to make in men or in women ovaries to make their hormones. And
Hmm.
that's important. So if your testosterone and growth hormone are peaking overnight and into the early morning hours, waking up and having a good source of animal-based protein or a whey protein shake or something like that. And I usually recommend getting 30 or 40 grams in the morning, however you got to do it,
Yeah.
right? Some people aren't morning eaters, but if you can do a protein shake or something like that just to get your protein, then that's fine too. So, timing is it's a nuance. It's a loaded question, right? You're going to hear 900 different
Yeah.
opinions on this stuff. But morning protein's probably better, and making sure you're spacing your total daily amounts of protein out throughout the day
Okay.
is probably the next most important thing, and making sure you're reaching whatever those goals are.
Hmm.
And there's some bare minimums. So for like women, 100, 120 grams of protein, even men, that's enough to
Yeah.
prevent muscle loss. But if you're trying to put on muscle, you're going to have troubles doing it. If you're at
Yeah.
that 100 gram mark per day, you really need to get 150 to 160 to 170, depending upon your body weight,
Yeah.
Um, so those are kind of the nuances with protein, but again, it depends on each patient's needs. I mean, some people need to lose weight, and then you want to incorporate calorie restriction.
Hmm.
So calorie restriction, high protein to minimize muscle loss, and then once they get the weight off, then you want to start packing on, increasing your calorie consumption again, maybe a little bit to increase muscle mass over time, get back to
Mhm.
sort of a baseline caloric needs are. But calories are important. Trying to lose weight, you have to be in a calorie deficit.
Yeah.
If you're trying to gain weight, you need to be in a calorie excess.
Yeah.
That helps.
Yeah. I got one of these Fitbits and I don't really use it, but I pay for the app and it was like I think it's like $80 for the whole year. But it's a good little tool,
Yeah,
because I can scan any package and it'll keep track of all my stuff throughout the day. And I can go on the app and say, look, I want to get up to 200 pounds. And
hmm
it'll tell me what I need to consume of each deal. And I mean, I'm just bringing that up because it's just another tool and it's affordable that people can
yeah.
use in order, to meet their goals. Because I think when it comes to this stuff, you have to make it easier for yourself
Well,
because you won't
and
stick to it.
a free way of doing it is going to there's calculators online. One's called the TDEE calculator, which is your total daily energy
Okay.
expenditure calculator, and it's I think calculator.net is the website we use. And you can just enter your age, your sex, your height, your weight, all that stuff, and then it'll tell you what your caloric needs are. And then it'll also tell you if you want to lose a half a pound a week, where do you want to be? If you
Mhm.
want to lose a pound a week, where do you want to be? If you want to lose more than that, where do you need to be? Or if you want to gain weight,
Yeah.
where do you want to be? And it's free to use. Anybody can use it, and we've used it numerous with most of our patients, and it's pretty accurate. So
Nice.
and it's free and easy to do. Now, if you want to track your calories and scan bags, that's helpful because you're learning in that
Yeah.
process. Okay, I want this bag of whatever it is, and if I eat the whole thing, how many calories are in it? What's it going to look like? How much protein?
Mhm.
So and that's great for someone starting out because a lot of times we consume things that we have no clue what's in them.
Right.
So now they know most people eat the same 10 or 20 things, and
Yeah.
after doing that for a few weeks, you know exactly what you're consuming,
Yeah.
you know?
Yeah,
So,
that's what I do, and it drives my chick crazy because I can eat the same stuff because I what I look, I just make it easier for
yeah,
myself. So I know, look, I feel good eating these things and I feel good implementing these things into my life on a daily basis. So all I just need to do is just keep consistent with these things. Look, I get bored eating the same stuff all the time, but it's the purpose
sure.
instead of anything.
Well, I think men are different too. My wife, she likes to mix it up a little bit, and I'm like, "What is this?" What happened to the old fashions? She just is like they like to experience different things. I think
Yeah.
I'm the same way. I could eat the same 2 or 3 things for lunch, 2 or 3 things for dinner,
Yeah.
2 or 3 things for breakfast. It keeps my life simple. I
Yeah.
know exactly what I need to buy, and it's prepared, it's ready to roll, and I'm
Yeah.
good to go.
One thing, like, since I've actually, obviously, wanted to, change my health and got my life, in that aspect, that is kinda I every time I go grocery shopping, I'm looking at labels, and I think a lot of people don't read a lot of the labels, and, you know, if it has 25 things on there, it's probably not something that you should be sticking in your body, you know
Yeah,
what I mean? That's just the way that I go off of it, and, like, whenever if I do eat something out of norm, I make my lunches. So, I just thaw out ground beef, and I just do whatever I do, and because I work for myself, so it's very easy. I get people that are like, "Hey, you wanna meet up and we'll get lunch," and I pretty much don't even
yeah, don't
I
even
just bring my own
entertain it,
deal.
yeah.
Yeah. Um, but I it's there's just so much stuff and that you can consume, and even with the calories, like we were talking about earlier, like, people don't look at the labels and see exactly how much you're consuming on some of these calories, and it's crazy, the
Yeah.
amount of stuff that you're taking in.
Well, and the problem with processed food, obviously, we don't know the long-term effects of all these things that are in our food, but the vast majority of people can detox these and get them out at small levels.
Mhm,
But if you eat processed food, what the literature supports is that you eat too many calories,
mhm,
and calorie consumption goes way up, and then
mhm.
you start wrecking your metabolic health for the reasons we've already talked
Yeah,
about.
exactly.
And it's not that you can't have a chip every once in a while. It's just don't eat the whole bag of Doritos. You
Yes,
know what I mean?
yeah,
If you're at a party or something like that, and you're the Eve party or whatever. You can partake in some fun.
Yeah,
You know what I mean? But you don't want to just make your life so regimented that you can't have some sort of flexibility.
for sure.
You know,
Yeah,
but
yeah.
have fun with it. We don't, small, portions of these things are probably okay, but be wary of what you're consuming overall, calorie wise. And
What's your opinion on alcohol consumption?
I mean, there's no medical reason to consume
Right,
alcohol. You know
right.
what I mean? There's
As
there's
far as creating issues with your hormones, I mean, there's not to mention a lot of alcohol has got a lot of sugar in it, and I don't
Sure.
think people know that as well.
Well, it's loaded with, easily digestible carbohydrates, and there's plenty of literature that supports if you drink, 2 or 3 drinks at nighttime before you go to bed, it wrecks your sleep cycle.
Hmm.
Now, it's probably less toxic if you have it during the day or something like that, but it's also just a form of empty calories. So, going back to calorie counting, if you have 2 or 3 beers a day, I mean, that's what, 400-600 calories.
Yeah,
Do that every day. That's,
yeah,
in 2 weeks' time, that's a pound and a half fat.
yeah.
So there's no reason to consume it.
Right.
I I drink alcohol, but I don't. I probably drink twice a year. You know what
Yeah,
I mean? That's just
yeah.
how I am. I don't. But we used to think, oh, it thins your blood. It's good for your heart. That's all
Hmm.
bogus. There's no reason to consume
Yeah,
alcohol at all.
yeah. The wine. They always talk about wine. Drinking a cup of
Yeah,
wine.
the polyphenols and the plant compounds, and the problem with that is, in order to have any sort of positive effect on your health from that standpoint, consume like bottles of wine.
Right.
To me, it's just empty calories. It's like having a treat
Yeah.
that you can reward yourself with once in a while. But as a general rule, there's no medical benefit to consuming alcohol at all.
Yeah. Let's touch on some of the peptides and longevity
Yeah.
style stuff, because that's what I'm super interested in this, because I've been reading a lot of books on this stuff, and I also take some different peptides as well. Um, Also, let's touch on the NAD plus and what is it? There's NAD, and then there's another one that they're saying that you should take with it. Is it NAC or
There's NMN,
NMN?
and then
Yes,
there's also
it's a big push
NR.
right now with a lot of
Yeah.
that.
Well, so peptides are, going back to the peptide conversation. I look at them as added therapy to people. The vast majority of people probably don't need them. They,
Hmm.
they are costly. They're
Yeah,
they're pricey right now. There are some mostly animal studies on these things on different peptides, and there are some human trials on some peptides, but we don't have the literature like we do with hormone replacement therapy or even pharmaceutical drugs or anything like that. But so they're the ones that I typically recommend for patients if they're trying to improve muscle mass and performance and feeling better and sleep quality are the growth hormone peptides, the growth
hmm
hormone secretagogues, and then subcategories with ipamorelin, CJC, sermorelin. There's a bunch of them in the
yes,
category. We tend to use sermorelin or CJC or ipamorelin. Um, and what they do is they basically just stimulate the pituitary gland um, to make growth hormone.
hmm
And you want to, most people recommend taking these at night, and there's all types of dosing schedules. And do you need to cycle them and 5 days on, 2 days off, and 1 or 2 months on, 2 months off? Exact dosing we don't have quite figured out. I mean, there's some recommendations out there,
hmm
but how they work is they tell the pituitary to stimulate growth hormone, and growth hormone is one of the repair processes of the body. So the pituitary gland will secrete a growth hormone, and it has a very short half life. We're talking minutes.
hmm
So by the time you wake up, your growth hormone's back down to normal if you take these shots before you go to bed.
hmm
But whenever they circulate in the body, makes what's called ILGF1 or IGF1, which is insulin-like growth factor
hmm
1, and that has a lot of positive effects, and it does that through the liver
hmm
predominantly. So I like the growth hormone secretagogues. People get some benefits from them. But the problem with any of these peptides is once you come off of them, you might lose those benefits. So you have
Yeah.
to kind of be dedicated to the process,
hmm
depending on what your goals are. I've used some of the growth hormone peptides in the past, and I've maybe got some benefits from them, but I don't use those anymore personally.
Yeah.
And then you have some of the thymosin peptides,
Yes.
like TB500
Yeah.
and thymosin alpha 1, and then thymosin beta 4, which, TB500 is basically the active component
Mm-hmm.
of that as well. But they're derived basically from thymus tissue. So when we're
Mm-hmm.
born, we have a robust thymus gland,
Mm-hmm.
and it sits in our chest, just under
Okay.
the sternum. And these have a huge impact on our immune health. Our cellular identity is the best way to think of it.
Mm-hmm.
So our body makes T cells, B cells. These are all immune cells that are made in the bone marrow, and they circulate in the body, and they get exposed to different things. And the thymus gland, if the best way to think of it, is it sort of designates what cells are going to do what. But as we get older, or 8, 9, 10, early teenage years, that thymus gland is basically involuted, gone away.
Mm-hmm.
So we can supplement with these remnant peptides, and it sort of boosts the immune response. That's the best way to look at it. And there's
Mm-hmm.
some data even in human models or in vitro studies where they've looked at cancers and autoimmune disease and prevention and treatment of autoimmune processes. And they do have some positive effects. Now we
Mm-hmm.
need more data, right?
Yes.
These are all in their infancy.
Yeah.
But I tend to like um, thymulin, and I also like TB500 and thymosin alpha, but we use mostly thymulin. And the reason I like thymulin, which there's two types of thymulin, thymulin and thymulin, but I like thymulin, and is because they've actually done some studies in Russia, which you always have to question literature
Yeah.
out
Yeah.
of Russia, but where they combine it with apidolon, and they've seen normalization of biomarkers of chronic disease. So, but I will cycle apidolon and thymulin together. And again, how do you do it? Do you do it once a week, twice a week, a heavy dose of it every 3 months, every 6 months? We don't really know.
Yeah.
But I tend to be less is more with peptides as well.
Yes.
So I tend to cycle mine about every 6 months or so.
Mm-hmm.
But I do a little higher dose when I'm doing it. That
Yeah.
makes sense. And again, dosing is different per provider and recommended dosages, but we don't know what the best dose is for a lot of these peptides.
Yeah.
And apidolon is a nice peptide because apidolon increases what's called telomerase activity in the cell.
Mm-hmm.
So every cell has a nucleus.
Yeah.
Remember back to biology from
Yes.
middle school years or whatever, and that nucleus is the DNA, and that DNA is packed into chromosomes, and it's wrapped around histones, and on the ends of the chromosome we have what's called telomere, and telomeres basically protect the DNA.
Mm-hmm.
So one of the mechanisms that's been proposed for apidolon is that it increases telomerase activity, which is the enzyme that sort of caps the DNA and protects the DNA.
Mm-hmm.
So, my interest is longevity. So, immune system, obviously, and also to prevent, cancers and inflammation and all of these things that are going on in the background of our body,
Yeah.
but also DNA protection to prevent cancer. And there's no hard evidence and large, randomized trials with humans that prevents cancer, but it just seems to make sense that you want to protect your of every
Mm-hmm.
cell. And they do have some data, again, out of Russia when they combined the apidolon and thymulin that increased lifespan in humans, and these
Yeah.
are elderly patients. So, but again, more data is obviously always needed with these peptides. We just
Right.
don't know. So those are the big sort of categories of peptides that I like to use, and there's others out there: PT141, AOD
Yeah.
9604.
MK677.
So many of them,
Yeah.
and the one of the downsides I'd say to you can't have immunogenicity reactions to these, which means they stimulate the immune system in the improper way. So that's not all. It's not all good news necessarily, but the vast majority of patients do
Yeah.
get good results from it.
Yeah. Now, I know even with testosterone, I've always heard, especially with the anything that increases HGH. And this is, I don't know for sure if this is facts, but if you do have some type of tumor in your body, it can essentially make it grow. Is that correct?
Well, we in animal models, yes, and there's probably some scant evidence in humans. But again, the question is, what was the trigger for the tumor, right?
Yeah.
So, what was the process? And I think we need to understand more about that before we just say all growth hormone secretagogues are bad because of that, you
Mm-hmm.
know. And there's a lot of people that, when I go to conferences and different things, we sort of talk about this. But there's plenty of evidence to support that it doesn't,
Yeah.
right? There's if you go to sort of the clearinghouse of literature for physicians and to the public is PubMed.
Okay.
If you go to PubMed, you can find all these. You just Google it or go to PubMed and search it, um, and you'll find all kinds of studies that support. Or what you want to look at is what's the preponderance of evidence, right? So
Yeah.
meta analysis studies are the best, where they'll look at it's a study of studies. So they'll have selection criteria for a study, and then they may come up with 10 studies, they may come up with 40 studies, they may come up with hundreds of studies that look at this.
Mm-hmm.
And you want to look at the meta-analysis of studies so that you're not just cherry picking one study that proves or disproves what your belief system is.
Yes.
So, and time will tell. We need just more data, more time on these peptides
Mm-hmm.
just to see. But it appears most of them appear to be safe to use.
Yeah.
Especially the thymosin ones, the apidolon, and then some of the growth hormones appear to be safe, and those are okay. AOD 9604 appears to be safe too.
Mm-hmm.
But again, it's something you gotta be dedicated to,
Yeah.
right? If my patients aren't willing to spend the money on it over the course of a year or two, then I'll just say, hey, well then don't do it. I mean,
Yeah.
it's if you're just going to do one cycle of something,
Mm-hmm.
I don't want to take your money just for you to try out a peptide,
Yeah.
right? You really need to dedicate some time to it and make sure you're doing all the things that we've already talked about,
Yeah.
lifestyle and exercise, and then you'll get results from it.
Yeah, it's definitely they aren't cheap. And right now I'm using that TB 500, and then also what is it? It's not BPC 157. What is it? Can't remember.
Sir Moreland?
No, no, I got some Moreland. I use the one bottle. I tell you what, honestly, whenever I first got into peptides, uh, I was using the Epimorelin and with the CJC 1295, and I stayed pretty. It made me super lean. It
Mm-hmm.
leaned me out. But I tell you, the combining them, some of the I don't know if you call it like throbbing or whatever, but I could, especially with the CJC, because I think it's pituitary gland, and
Mm-hmm.
then the epimorelin is basically your scrotum, correct? Or do they both?
They work on. I think those actually work on. They're growth hormone secretagogues, but they're also the subcategorized as like ghrelin receptors. So they'll.
It was pretty powerful. I'll just say that.
Yeah.
Like whenever I would inject them, I could feel it, and I would start, like it'd make me sweat,
Mm-hmm.
and a couple times, thing was I was probably, doing a higher doses because I would play around with it, and I use that. There's a calculator, a peptide calculator.
Mm-hmm.
It's free, so it kind of tells you 250 because you get into micrograms instead of
Right,
milligrams,
milligrams or units, which is
Yes, and
compatible with micrograms
but
usually. Yeah.
some of the whenever I would use them, it was pretty powerful. Like
Yeah.
I could definitely feel it working. Also, not to try to jump out of peptides, but I wanted to ask you about like for people that don't like injecting testosterone, you got the pellet, then HCG and Clomid.
Mm-hmm.
I I used HCG before I got on testosterone. I was doing that. That's what I was using at Victory. Before the testosterone wise. But I know that obviously injecting testosterone is way more powerful than them two.
Yeah.
Essentially,
So with Clomid, you can get a slight bump in testosterone, and it works as it basically stimulates the testes to do the job, whether it's sperm production for testosterone production. And the problem with HCG is it's usually not a great tool long term
Mm-hmm.
because you develop tachyphylaxis to it. Tachyphylaxis is the medical term for basically your body just stops recognizing it.
Okay.
So most guys will, if they use HCG, you'll get a short-term benefit, maybe 6 months,
Mm-hmm.
and after that, it just kind of stops working. You'll see their levels go from 300 to 500,
Mm-hmm.
but it's not like it's going from 300 to 800. Right? You're
Right.
not doubling or tripling your testosterone production. But for young guys, it can be beneficial, obviously, if they're still trying to have kids, or you can use it as combo. So with testosterone to help maintain sperm count if you're trying to have kids or whatever. And then, it's always hairy. How do you dose it? Do you do it twice a week, 3 times a week, daily? I mean, there's all different types of dosing schedules out there for HCG. HCG is fairly well tolerated.
Mm-hmm.
But Clomid by itself or with HCG is, in my opinion, I don't want to say worthless,
Yeah.
but it basically is when you're comparing the effects overall of testosterone versus Clomid and HCG. Clomid blocks the reflex mechanism back in the brain and sort of tricks your body into making LH and FSH, which stimulate the testes. But Clomid has its own side effects.
Mm-hmm.
It's that you just don't see with testosterone. With Clomid, excuse me, um, with Clomid you can get depression or mood issues. I've seen that a couple patients where we tried to use Clomid instead of using testosterone. But I can't recall a single patient that was happy on HCG and Clomid.
Mm-hmm.
That and every single patient we ended up switching them to testosterone.
Yes.
That's just because testosterone is, it's really your end product.
Yeah.
If your goal is to raise testosterone and to feel better, and you have low T, almost inevitably have to use testosterone.
Mm-hmm.
It's just way better, way more
Yeah.
efficient, and it's way easier to dose. The responses are similar amongst individuals, so it's just better of a therapy than Clomid or HCG
I
by
gotcha.
itself.
I gotcha. And then what's your thoughts on the pellet?
Oh, for men, I don't like pellets, just because mechanically you have to put a lot of pellet in.
Really?
Yeah,
Okay.
so you're causing a lot of scar tissue. Got to do it every 3-4 months.
Mm-hmm.
Some guys like pellets, but the vast majority of guys, you're going to get results with it. It's easier to do.
Yeah.
You don't have to come into the office like you do with pellet therapy.
Yeah.
And we're talking, I mean, the pellets can be 1.5 inches long.
Really?
Yeah, and they're tiny, but you might have to put 6, 8, 10 of them in.
Really?
And if you don't have a lot of subcutaneous tissue,
That
then
hurts.
you're causing a lot of pain. And it's most guys that get a pellet, they'll switch to injections almost immediately.
Oh, I
It's just
guarantee that's
now for
painful.
women, different story.
Really?
Yeah, because we use baby pellets for women.
Okay.
The testosterone's tiny, and then the estrogen's even smaller than that. So it's super easy to do. It takes 5 minutes. You just put the pellet in, and you get stable production of release of the hormones over a 3-month period. So women, different story, and women also carry a little more subcutaneous fat in their hips,
Mm-hmm.
right? So it's a much easier, less inflammatory process to put a pellet in a female.
Okay.
So for women, I love pellets. We use creams and injections for women too. But for men, I'd say 99% of my patients are on injectable.
Yeah.
It's just easier to dose.
Even with the cream too, though, I've heard people use the cream, and I think one thing that's important that people need to understand is that also is anytime you inject anything, you're going to get more of a benefit.
Yeah, if you put it in under the skin, you're going to get an absorption that's very close to 100%.
Yeah.
So I think injectables are good for men and pellets but women can sometimes they don't want the huge effects of the testosterone, so we'll start them on a cream. And there are some women that absorb it well. They stick to doing it every day. That's the other downside. You got to remember to do it every day, and some people don't remember that.
Yeah.
But you can use a cream for women. Again, most of the benefits come
I got you.
from or injectable testosterone if they're on testosterone.
Yeah.
Because you're right. Once it gets under the skin, you're going to absorb almost all of it without any problem.
Yeah, because yeah, I was, even using the L-carnitine and glutathione. Now I'm injecting it, but before I was just, consuming it, and I didn't
Hmm.
feel like I even get even close to the benefit because I mean, I do, I'll basically what I do with the glutathione and the L-carnitine is on the days I work out, which is roughly probably 4 days a week. I'll actually lift. If I don't lift, I'll either go out there and get in the sauna and then cold plunge, or I'll do a weighted vest walk and I'll walk around my neighborhood for 20 minutes with a 50-pound weighted vest in the morning. But I can I can feel it.
Yeah.
I mean, it gives me pretty good energy. You know what I mean?
Well, yeah. I mean, L-carnitine is good, especially for fat mobilization. You know, oxidation of fat. Um, and glutathione obviously is a super powerful antioxidant.
Now,
Prevents.
is that classified as a peptide then, or what do they
No,
classify
it's
that
just its
as?
own compound. I mean, it's basically um, three amino acids that are linked together. You
Hmm.
know, is what glutathione is, and we I like glutathione. I usually typically do it once a week myself as an injection just to get some glutathione in there.
Hmm.
But you don't absorb glutathione very well from the gut. So when you supplement it,
Yeah.
your the bioavailability goes way down
Yeah.
versus when you inject it.
Yeah.
And there's some evidence that maybe it helps with reactive oxygen species. The question, does that correlate to any sort of protection of the mitochondria and cancer and all these things? Who knows, right?
Yeah.
But it's clearly plays a role in detoxification in the body. So that's why I take a little bit of it at least once a week shot
Yeah.
for thiam. And I don't use L-carnitine personally, but um, but a lot of people swear by it.
Yeah.
If they're working out and lifting weights, and they'll notice significant reductions in body fat and
Hmm.
also visceral fat when they use carnitine.
Yeah.
So, but yeah, those are just added on, therapies that people can do.
Yes.
And you kind of talked about NAD. I actually really like NAD. I've
Hmm.
been using it for a few years, and I've noticed improvements in mental clarity and energy
Yeah.
personally. Now we can argue whether or not there's data in the longevity literature for humans. There's not yet.
Okay.
They're still studying it, but its mechanism to me makes sense. So energy or NAD is just the energy molecule.
Hmm.
Whenever you have substrates like glucose or fatty acids that go through the mitochondria, the goal is to make ATP, and NAD does that. So
Yeah.
when it acts on the mitochondria, it helps make ATP, and ATP will give you energy. The thought is that it influences sirtuin activity in the cell. Sirtuin's a group of enzymes. There's like 7 different ones, 10 different ones. I can't remember the important ones. Sirtuin one. Sirtuin one. What it does is it acts like it cleans up the epigenome. So you have
Hmm.
DNA, and then you have methyl groups on the DNA, and that sort of deactivate and activate certain transcription factors inside the cell through the DNA, and it's believed to sort of clean up the methylation patterns on the DNA.
Hmm.
Now, again, we have animal studies, and we have some studies in humans that it increases exercise performance and endurance, especially in athletes. So, and I can tell that I feel better when I take it. But
Yeah.
again, it's one of those things that probably low dose is better.
Hmm.
Daily use probably is better. A lot of these IV clinics out there, and these,
Yeah.
they'll give you a $300 bag of NAD or whatever it
Yeah.
is, but you're just getting it one time. That's
Yeah.
useless, right?
Yeah.
It's like you gotta continuously stimulate your body with these things. Otherwise, you're not gonna provide any benefit overall.
Yeah. We did. When we went down to Daytona, we were out. Obviously it was bike week, so we drank a lot and everything else, and we tried out one of them IV places, and yeah, it was. I think it spent like $300 or $500 for like the
Yeah.
recovery deal just to try it out because I was curious about them, because I guess they've been around in like Las Vegas for a long
A while,
time,
yeah.
and but honestly, I think I wasted my money.
I
You know what I
think, yeah,
mean?
yeah, you're
I
right.
didn't really. I was still hungover. I didn't really feel too much,
Yeah,
greater.
it'll make you go pee afterwards because you're
Yeah, I
getting
mean,
a
I
flip.
thought I was gonna just feel like amazing and
Yeah.
get up out of the because they put you into like a massage chairs
Mhm.
and blankets and everything, and yeah, essentially feel like I blew my
No, it's a
money.
fun thing to do if you're like, if you're having like a day out with your girlfriend or something like that, or maybe girls like to do it if it's like a
Yeah,
women's day out
yeah,
or something, kind of like getting their nails done. But it's as far as it providing any long-term health benefits, no. You know,
right.
you have to, and to be honest with you, the best way to stimulate all these things, whether you're looking at longevity pathways and sort of biochemistry, we don't have to go and get into all that, but the best way to do it is eating the right amount of calories
Hmm.
and not over consuming calories. Because once you start over consuming calories, you start deactivating your longevity pathways and accelerating your aging pathways in
Hmm.
cells. And then the next best way to do it, even for NAD production, is simply exercise.
Yeah,
So cardiovascular fitness and lifting weights and all of those things, that's gonna do way more than any supplement would do.
yeah,
You know?
yeah. I tell you, and I tell people this, and obviously a lot of people don't want to do it, but I've implemented that cold plunging into my life almost 2 years ago, and it by far is one of the most instantaneous, greatest feelings and I'm addicted to it. I really am.
Yeah.
I can't explain it to you. Obviously it's miserable getting in the cold water, but I also dunk my head. I've looked into some different stuff. You actually get more benefits if you dunk under the water, but it by far
Yeah.
it gives you great it makes me feel great and it gives me more clarity and my
Sure.
energy levels are higher. The same with the L-carnitine, like within, probably 20 minutes of injecting that, I feel like I'm more awake. Maybe it's a placebo
Yeah.
deal.
Who knows? But
I don't know. But it's it's just all these things combined together,
yeah.
is really what it
And you got to
comes
find
down
out what
to.
works best for you.
Yes.
Might have a completely different response to something like that. And obviously, cold plunges, there's a little bit of data on those.
Yeah.
And, obviously, you don't want to go out there your first time and jump in 37-degree.
Yeah.
There have been case reports too of people having cardiac
Yeah.
arrhythmias and dying because it's like a shock. It's
Yeah.
like, oh my God.
Yeah, and I didn't that's how I am, like, I'm, like, extremist to stuff, and so I was watching Wim Hof and, and listen to him if you know who Wim Hof
Mm-hmm.
is, and, so I went and bought a horse trough, I let it freeze over, and, this is how I started doing it, I let it freeze over, and it was like 21 degrees, and
Yeah.
I got in there, and I lasted for like 35 seconds. Well, then, I'm like, I can mentally force myself to do stuff,
Yeah.
you know what I mean?
You can also get benefits from just below traditional body
Yes,
temperature,
yes.
right?
Yeah, 50 degrees and below is
Yeah.
supposed to be like that's what I tell people too, but I didn't know
But
the
even
whole
60,
cardio.
70 degrees, you get some benefits. It's those cold shock proteins that you're
Yeah.
activating, and then you want to slowly decrease that down because people just
It
go out. I mean,
yeah.
there's been people that have actually died from
That's
it.
what
It's
I'm
like,
saying.
yeah,
Like I didn't know about the whole cardiac deal, and I'm out there, and I tell you what, I would get out of that, and like I would be like,
stiff as can be.
yeah,
Yeah,
and but I would feel amazing. But
yeah,
even like I'm a firm believer, like the human body is miraculous. It will adapt to things, you know what I mean? Because I just think of like ancient human beings and the stuff that they went through, you know what I mean? It just
yeah,
unbelievable. Like, they talk about like a caveman, the average caveman was like 6 foot something, 15-inch forearms. I mean, these are massive human beings, you know what I mean? That barefooted in winter. I mean,
yeah.
so this is stuff that really goes back way further that is essentially
Well, these are all what we call hormetics. I mean, they're just stressors, and what the literature tells us is that if you stress the system intermittently, you don't want to do it all the time. You
yes.
don't want to live your life in complete stress or in
Yeah.
cold water or whatever it
Yeah.
is. But it's same for a sauna. I mean, there's obviously a different set of proteins that are activated in sauna, but there's literature says that intermittent exposure to extreme heats is good for you.
Yeah.
Intermittent exposure to cold is good for
Yeah.
you. Same with exercise. Intermittent exposure to high intensity interval training, great
Yeah.
for you. Lifting weights, same deal. All of those stressors prepare the cell to undergo stress better, right? Or
Mhm.
to survive longer. So, and whether it's a longevity pathway here or aging pathway here or whatever it is, or proteins or mechanisms or mitochondrial health, stressors at the right dose and that for everybody that's different are good, right? You just
Mhm.
have to figure out what works the best for you,
I gotcha.
you know?
Yeah.
But that's all called hormetic therapy.
Yeah.
It's stressor therapy, what it is, you
Okay.
know?
Yeah, so back to the peptides because there's so many, and I know like now there's also I just recently seen, and I can't there it's a source of plant peptides that is coming over from Ukraine. Have you seen this? They're it's a certain name, but they're peptides that are derived from plants.
Are they called bioregulators?
Bioregulators.
Yeah.
And I recently seen this because I was watching I can't remember what podcast, but they were talking about it and they're saying that we're seeing a super huge influx in the United States since the Ukraine war. And there's supposedly I don't know, I haven't looked into it, but supposedly a big facility got bombed over there during the Ukraine war. And
So they're all
there's the
making their way.
bioregulators, and a lot of people are jumping on this because
Mm-hmm.
there's, because with the peptides, I guess the FDA is kind of trying to backdoor people, and they're trying
Yeah.
because obviously there's a lot of money being made off of peptides, and they want to be
Well,
a part of it.
they've definitely come out and said that some peptides, at least the way they're being made, whether it's an underground pharmacy or compounding pharmacies, they're maybe not as pure as they want them to be. And anytime you're injecting something that's not as pure, obviously we don't know what it can
Yes.
cause, right? If you're getting all these extra proteins inside your body, and that's kind of what I alluded to earlier was what they call immunogenicity.
Okay.
And immunogenicity is just basically it triggers the immune system in a way it's not supposed to be triggered. It can
Hmm.
cause a reaction, anaphylaxis, or a rash, or something like that. Like a mini autoimmune process because
Hmm.
it's not pure, right? So the FDA has kind of stepped in and said, yeah, we don't recommend these. And they now there are compounding pharmacies that still make them, and they've even modified the peptide, and it's hard to stay ahead of the industry here and regulate all this stuff, government agency, but the bioregulators are, as far as I know, they haven't been regulated yet, but bioregulators are basically tinier molecules, so they're fewer than just a couple amino acids linked together, whereas a peptide might be 20, 30, 40, 50,
Hmm.
upwards of 70 or 80 peptides linked together. But the bioregulators, the belief is on their mechanism is that they work a little differently, and they actually go into, because they're so small, they can go through the membrane of the cell and into the membrane through the nucleus, and then actually attach on DNA and affect transcription of proteins that way. So it kind of turns on and off DNA.
Hmm.
So, but yeah, there's all kinds of bioregulators out there, whether it's for hormonal production or whether it's for thyroid health or whether it's for immune response or even cardiovascular disease and heart failure. And, those are usually the oral formulations you'll see.
Okay.
Those are bioregulators. And there's some pharmacies that are making them in the United States. I've heard about them and learned about them at conferences and things like that. But yeah, I don't know. But I don't know about the whole Ukraine deal,
Yeah.
but I
Yeah.
know they
Yeah. I think.
most of these peptides were studied mostly in Ukraine and in Russia because
Yeah.
they've been looking at this for years.
Yeah. Whenever you was talking about Russia earlier, I mean, what was it? The documentary Ikra, I
Oh, I
think it
haven't seen
was.
that. I'll have to.
Okay, well, it was basically it's a true documentary on how one of the scientists in Russia, he basically sold out Russia on how they have essentially cheated at all the Olympics for
Oh
a
yeah,
lot of
yeah,
years.
yeah,
Really good documentary. I mean, he's over here in the United States.
yeah,
We've actually hid him over in the United States, but his family has been over there. And but I mean, even like China and the Bulgarians, these a lot of these compounds have been used by these countries for years.
yeah,
I mean, I even like listening to some of professional athletes. You get professional athletes. They're 240 pounds, solid muscle, and we're
yeah,
just drinking protein shakes. Or eating.
yeah,
You know what I mean? A lot of people don't want to talk about that these individuals are using compounds a lot. You
yeah.
know what I mean? But like Russia and all them, I'm sure they got a lot of research on a lot of this
Oh, they do.
stuff.
They do, and a lot of them are animal studies, and there's some human studies too. But just like with any drug approval process, and even drugs that make it to market now, they're still doing what they call post-market analysis. That's the function of the FDA. They'll mandate that after they approve a drug, that we monitor things,
Hmm.
even for years afterwards, and then they
Yeah.
have a database where and if they start seeing things where they're getting higher rates of pancreatitis or heart disease or heart failure, then they'll investigate why that is. Um, and then they'll change their black box warning, or and all the warnings on their package inserts and whatnot. But for peptides, we just don't have that,
Hmm.
and we don't know what'll happen with the FDA. I mean, clearly, I wouldn't be opposed to any sort of regulation,
Yeah.
is to get better data, right?
Yeah.
And problem is it's a if these drugs work, then usually they get bought up by a pharmaceutical company, and then they get the research that they need, and when it goes back to market, that it's just a one approval by the FDA, and then the price of the drug goes way up.
Yeah.
So like, oh, they approved this drug for X, Y, and Z, therefore it's off market use if you use it outside of that. So it's highly regulated.
Yes.
And the thought is that they're just peptides, right? They're not harmful, and I don't think that's the case. I mean, I think some people can have a reaction to a
Yeah.
peptide, just like they can have a reaction to eating peanuts, and they could
Hmm.
end up in the hospital and die from something, you know. So you just got to be careful with patients and make sure that best interest of the patient, and having some sort of safety standard or protocol that you're following, and that's why we use very low doses of peptides to see how
Yes.
patients respond. And then if you want to go higher, then let's talk about that,
Yeah.
or how do we cycle this or do it. Clearly, there will likely be some regulation coming on these peptides and regulate those
Yeah.
things, at least the ones that work, right?
Yeah.
Yeah,
Yeah. Yeah. We were talking about the TB 500 and BPC 157 because there's a lot of people using this for obviously injuries. And I've used it before. I don't know if I essentially felt any different or anything like that. But I know there's a lot of people that claim that it does great things. And then with the TB 500, you hear a lot with gut health, you know,
yeah.
with stuff in bio
The
stuff.
biome and everything. Well, gut dysbiosis causes this phenomenon called leaky gut, which is
Mhm.
an inflammatory process of the bowel. And anytime you're taking a immune regulator, it theoretically, some of the other peptides that we didn't really discuss much about is mitochondrial peptides. I really like those. SS31 and MOTS-C, those are the two that tend to help with mitochondrial biogenesis and helping the mitochondria kind of grow. That's,
Mhm.
mitochondria are responsible for production, and they have a whole other host of actions inside the cell. But SS31 and MOTS-C, those are ones to do some research on and literature search on as well.
What is it? Slank. Slank is one as
Selenk is
well.
one, yeah. That works on the GABA receptors.
Hmm.
So, GABA receptors in the brain and the nervous system, they help with anxiety and irritability, and have a calming effect
Hmm.
on the stress response in the body. So, I've never prescribed that to anybody, but it is a peptide that can help with that.
Yeah. 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 The MOTS-C, I've listened to a lot of people talk about. talk about that one, and they say it's pretty good. Um, like I said, I've experimented with the Epimorelin and the Simorelin and CJC 1295. I know you got Tesamorelin. You know, it's more expensive. I guess Cimarelin is like one of the very first ones that ever hit the
Yeah,
market.
it was one of the first. That was the first growth hormone secretagogue I think that came out. You know, and since then they've sort of refined it and taken active uh, peptides from different different structures of different growth hormone secretagogues
Hmm.
and make them fine.
Yeah.
That's the goal. But Sermorelin was kind of the initial one.
I try to tell people about some of these because I've had individuals contact me and they're like, trying to get HGH, and a lot of people, get ripped off buying this
Yeah.
stuff, and even there's, even sites where people order stuff and it's not cheap for one, and then for two, which I'm not sure, but it makes a lot of sense. It's kind of like with testosterone. Once you start using the compound, your body will stop producing it. Whereas with the peptides, you can essentially it doesn't shut down your natural production.
Yeah, so most of the growth hormone secretagogues, um, basically they're just stimulating the pituitary to make extra growth hormone.
Hmm.
So when you're sort of acting at level one, where the process starts, you're still not inhibiting the reflex mechanism back. If that makes sense. You
Hmm.
know, whereas if you take testosterone, which is the end hormone production, testes make it under the influence of the pituitary gland. If you increase your testosterone, then you're going to shut down, LH and FSH, which are the pituitary hormones.
Hmm.
So you just don't see that with a lot of these peptides.
I gotcha. Also, to touch real quick on what we're talking about right now, and then I don't want to keep you too long. I got a couple more things I want to touch on, but
Yeah.
uh, I think this is another thing important to put out there, but because you get people that think that you get on testosterone replacement and you're just on it for 6 months and then you're good, and
Mm-hmm.
I try to explain to people that this is a life thing, you know what I mean? Like you
Yeah.
get on this, you're not coming back to your same levels, if you come off. I mean, I guess you could essentially use HCG to get your testes to start moving. I know a lot of people use that
Yeah.
type of.
Well, so you're not gonna your body will make some testosterone production again after you come off, but it takes time to do that. Usually, 6 months, your body can start making some testosterone again. But you're never going to get to the level of where you're going to feel good on your own naturally if you're already at a low level of testosterone production. That makes sense.
Yeah.
So some guys will try it for a short period of time and then come off of it. Although any benefit that they had gained on testosterone, you're going to lose.
Yeah.
So you should think of it if you start testosterone as potentially being on something for lifetime almost. I
Yeah.
mean, that's sort of the given, and that's what I tell most of my patients. I mean, but some people have financial issues or whatever, and they can't stay on testosterone, and that's understandable. And I've rechecked blood work on people too after if they've been on it for 6 to 12 months, and then we recheck, and they come off of it, and we'll recheck it at 2 months, and it'll be low, and
Mhm.
it'll be 100, 200. And after about 6 months or so, they might creep back up close to where they were before,
Mhm.
but they're never going to get to that 7, 8, 900 range without being on testosterone.
We gotcha.
Yeah.
Um, Methylated vitamins. This is a big thing now.
Yep.
What's the difference between a methylated vitamin and a non-methylated vitamin?
Well, so just one example would be like B12. It comes in cyanocobalamin and it comes in methylcobalamin. Um, those are the main two. One is obviously the methylcobalamin is the methylated form. And about 42, depending on what literature you read, about 42% of the population are under methylated. They have either deficiency in what's called or an abnormality in their methylation process with like MTHFR or COMT or whatever it may be. And those patients should likely take methylated forms. Outside of that, you're okay to do what you want.
Mhm.
Now, I do recommend if you're just going to go supplement with something without testing, and there's
Yeah.
really not a need to test, I mean,
Yeah.
for most people. then I would recommend taking the methylated.
Okay.
They're usually $1 or $2 or $3 more.
Yeah.
But if you're going to do it, go ahead and just buy the methylated forms, because there are patients that have MTHFR where I put them on just regular vitamins, and they can have issues. They have worsening anxiety or irritability, and that methylation component in the body is responsible for neurotransmitter synthesis, detoxification pathways, basically efficiencies of the cell.
Yeah.
So if you're not taking the methylated forms, your cells aren't going to function the way
Yeah.
but you don't need to go out and do a fancy $400 genetic test or anything like that. But if you're
Yeah.
going to take a supplement, just make sure it's the methylated forms, and you don't need high doses.
Yeah.
So you don't need to go out and just take, all kinds of methylated vitamins. Just a regular old methylated form of B12 and folic acid is fine.
Any good brands that you
And we,
can?
we make our own in
Yeah.
our office, and we formulate it with everything that you would need. Um, But really, just look for the methylcobalamin and 5-methylfolate is the two main ingredients that you want to look for
Okay.
when it comes to methylated vitamins.
Yeah. I think a lot of people probably do over vitamin it.
Yeah,
Uh,
overthink it.
yes,
You
exactly.
know.
I like a lot of the stuff that you can get from food.
Yeah.
Essentially, I think
Well,
that's more important
there are
to
some
understand.
extras that most people need based upon my experience with testing everybody. Vitamin D is low in almost everybody. So vitamin D, and you want to get that with K2, and you want that K2 to be in the form of MK7.
Hmm.
There's some argument of how much, 60 micrograms versus 300 micrograms. I tend to err on the side of more for vitamin K. Vitamin K plays a role in calcification in the body and bone health,
Hmm.
um, and then also magnesium. So almost everybody's deficient in magnesium.
Yeah.
Magnesium is used for energy production. It's used for detoxification pathways, everything, synthesis of things in the body. It's a cofactor. And then fish oil is the last one. So most patients are deficient in omega-3 fatty acids. There's a body of literature that says if you have a high omega-3 index, and we actually test patients, that we use what's called an omega-3 fatty acid index. And what it looks at is in the red blood cell membrane. You can see what types of fats are in there.
Hmm.
And if you have a low omega-3 index, there's some associated with cardiovascular disease, and dementia and Alzheimer's and inflammation.
Yeah.
So, but those are probably your core four supplements that most people need. And if
Yeah.
I had to add a fifth, it would be creatine.
Yeah.
So creatine is huge. It's probably one of the most studied supplements on PubMed. If you go in there and
Hmm.
just type in creatine studies, you'll find a lot, and the vast majority of them are promising.
Yeah.
So it helps with muscle production of energy.
Yeah.
It acts as a phosphate donor in the muscle. So when you're breaking down ATP and when you're lifting weights or working out, it'll act as a phosphate donor, and it helps with endurance and helps with muscle strength. And they have studies on this too to show this.
Yeah.
So outside of those five things, maybe some NAD or NMN, which is the precursor to NAD.
Yeah.
But that's really it. You don't have to go crazy and buy all types of
Yeah.
herbs and
Now there's a whole bunch of different magnesiums, and I know you can get into like different like what is it, magnesium citrate, for better sleep. I
yeah.
mean, different times to take it, different stuff like that. I mean,
Yeah, there's a whole slew of them. They're magnesium glycinate, citrate, and they all have different bioavailabilities. That's the big thing. How much are you absorbing from
Mhm.
these? And then also certain tissues like it, like orotate for the heart, citrates good for the gut and can help with constipation and things like that.
Mhm.
But I recommend, if you're going to get a magnesium supplement, just get a blended form. Just
Okay.
get something that has 4 or 5 different types, or 3 or 4 different types of magnesium in it. That way your
Yeah.
body will kind of figure out what it wants to do with it.
Yeah. I actually just recently, probably within the past couple months, threw creatine in because I started looking at some of this research on it. So I just buy from bulk supplements, and I
Yep.
just get the plain stuff,
It's all you
and
need
you
is
know what I
regular
mean?
creatine monohydrate, nothing
Yeah.
crazy, you
Yeah.
know?
I was always like uh kind of well, because I had blood pressure issues, and then the doctor was like, telling me like, you don't want to take his stuff because you could essentially, more water weight you carry, the higher it makes your blood pressure, all this,
Well, with
stuff.
creatine, usually that water weight's transient in the beginning
Hmm.
and it goes away. So after you've been on it for a few weeks or a couple months, it goes away. There's um, some evidence to support that it'll increase water in the muscle, which is not necessarily a bad thing, right?
Right.
But usually after you've been on it for a little while, that all goes away. Just have the other benefits of the creatine.
Sodium. This is a big one because I just touched on blood pressure, and I think a lot of people got blood pressure issues. And honestly, they had me on blood pressure pills and for years. And I ended up quitting them, getting off blood pressure medicine, and I feel way better,
Yeah.
but for years I was on blood pressure medicine and I was on thyroid medicine and I stopped taking all that stuff probably like 3 years ago,
Hmm.
and
Well, you also cleaned up your diet and lost
yeah,
body fat and
for,
all the good stuff,
for sure. But sodium, like there's a lot of research on sodium and how we don't consume enough, and I think they tell you you don't consume a lot of sodium, and for active people, it's a very powerful
Yeah.
supplement, you know.
Well, I think if you overconsume sodium, then it can cause problems too. There's a balance between all of this stuff, knowing what's right and if you're eating a lot of processed foods,
Yeah.
then you're getting a ton of sodium, and it
Hmm.
can cause some water retention. And even in, let's say, heart failure patients, um, most of those patients, if they eat sodium, it can be detrimental to cardiac function because of water retention and the heart doesn't pump right. And so I think there's a balance with all these things that we've kind of
Hmm.
discussed today, even. It's just finding that right balance and what works for you.
Yeah.
Yeah.
I wanted to touch on PRP injections because I know
Hmm.
you guys do that, and um, people get very common to get injured,
Hmm.
especially whenever you start getting into working out. If you're not, you're
Used to it,
listening to
and yeah,
somebody else, or
yeah,
I mean,
getting tendon or ligament injuries or
yes,
whatever.
so I wanted to touch on that because, especially, I don't know if you've seen this documentary that came out called "Don't Die."
Oh, I've heard of it. I haven't
I
watched
mean,
it
well,
yet.
I mean,
Yeah,
it's pretty crazy. I mean, it touches on a lot of stuff that we're
yeah,
touching on, and this guy is actually reversing his life. They're
yeah.
like proving this. Does he look healthy? He doesn't. I mean, he's so
I've seen
pale.
it. Yeah, I know. I
But
get you.
like they do the platelets
Yeah,
and like they're injecting his dad with his son's platelets, and essentially his health is getting better.
because he's getting, yeah.
Yeah, so
Well, yeah, that's a whole new field there's been some talk about it. You know, um, what we use platelet-rich plasma for is for musculoskeletal injuries. Mild arthritis, moderate arthritis, tendon, ligament injuries, things like that. Basically, you're just taking the patient's own platelets and spinning them down and concentrating them and re-injecting them in the body because the platelet is what triggers the healing response. If you were to
mhm,
cut yourself, the platelets go there, and then there's all kinds of secondary messengers that occur to communicate to other cells. And without the platelets, you would bleed continuously, and then you would also not heal very well. So
yeah.
but that's why we use it in our practice. But yeah, there is some thought with what's called you know senescent proteins within the body that causes the cells to age.
Mhm.
And there's some literature and some coming out now in the longevity space where they can do plasmapheresis and filter out all these aging proteins.
Mhm.
So I'm not sure if that's what he's referring to, but it
Yeah.
sounds like they're using his stem cells and
Yeah,
injecting
it's
his
pretty crazy. Yeah, there and like you got to watch the documentary. Also, last thing I'm going to touch on was stem cells actually. Because you hear about people going over to like South America and doing stem cells, and then I guess is it essentially illegal in the United States?
Yeah. Well, you can use what's called mesenchymal stem cells, and there's some amniotic fluid stem cells that you can use, but those are already partially differentiated stem cells. So those are You can use those in the United States. However, you can't use, fetal stem cells,
Hmm.
which is basically, that's a whole other religious and ethical conversation. But in other countries, fetal stem cells, which are not as differentiated, and they can sort of be pluripotent, which means they can kind of go into different areas of the body and do what they
Hmm.
want to do. The ones that we use here, and I don't use these personally in our practice, but the ones that some stem cells clinics are using are mesenchymal, which are already tissue derived stem cells. So amniotic fluid or umbilical cord, they use what's called Wharton's jelly,
Hmm.
which has a lot of stem cell concentration in there, but they're already differentiated into tissue.
Yeah.
So, if you inject them in the ligaments or tendons or in the uh, like knees or shoulders, sometimes it'll help lay down new cartilage, or at least
Hmm.
that's the thought.
Yeah.
So I've not seen a ton of great literature on those. PRP, in my opinion, is a safe process because it's your own blood product and you're injecting it right back into the patient. And we've had great results with mild to moderate arthritis and tendon injuries in the shoulder, bicipital tendonitis or rotator cuff injuries.
Hmm.
And it just works as a powerful anti-inflammatory. So it helps heal the tissue. It doesn't regenerate a new knee. It's not going to regenerate a new
Yeah.
shoulder. It's just a powerful anti-inflammatory. Is all that is.
I gotcha. Well, I guess we'll end it. If you want to tell everybody where to find you and obviously what your business is and everything, you know
Yeah.
what I
So
mean?
the name of our office is Performance Medical Clinic, and we're in Edwardsville, right off 157. So if you guys have any needs for hormone replacement therapy or want to try to live longer and be healthier, then reach out to us.
It works. You work it. So, hey, I got the stuff for you too.
Awesome, man. What is that?
This is coffee. It's only
Perfect.
organic beans.
Yep.
I roast them myself. Got a hat. Got a shirt. It's a large shirt. That's the only one size I got
It's
right now.
perfect.
And then a koozie and then some stickers for you. So,
Awesome. We need to get some more of our gear made.
yeah,
These koozies are a good idea.
yeah. Actually, I use a full deck down in
Who makes this?
I do.
You
What?
make your own coffee?
Yeah, yeah. I was roasting coffee whenever he was here. I buy like 400 pounds of beans at a time, but I only buy organic beans. Did you because the coffee is the most pesticide sprayed
Yeah.
plant in the
I've heard
world.
there's lots of mold and all kinds of
So
crap
this
in it.
is I buy green coffee beans. I bought a quality roaster and I roast them. I, what is it? Subscribe and like. But I've gotten into like coffee super deep into it.